co-creation network is all about co-creating, so it's very important that we're spanning traditional boundaries. The work grew out of a recognition from organisations, the Improvement Academy, the Leadership Academy, the AHSN, that we operate in silos, and that's really not the best way to do what we need to do. So it's about the organisations trying to learn to work together, as well as the individuals working together, and that has to include patients and service users, their families, the sector organisations, social services. It has to be about breaking down all of those boundaries and doing things really creatively and differently. I think it's recognising that we've got it a bit wrong. We've tried really hard to be very efficient, we've tried really hard to make sure we're safer by standardising things, following procedure, and in the process of trying to do all that with the very, very best of intentions, we've forgotten about the human bit, we've forgotten about the people bit, we've forgotten about the relationship bit, we've forgotten about the creativity. So techniques such as communities practice, which demand that people make those relationships to succeed, they're not compulsory, they're totally voluntary, so they allow people to really tap back into their values, their passions. It's just a really successful way, I think, of people rediscovering those really important key issues and using them again to do what they do even better.
The most memorable thing from today for me is feeling the increased energy in the room and noticing how this new approach to communities of practice actually touches people's hearts and emotions and feelings, and they begin to feel more connected with others, and it's that building upon that kind of social aspects and connectiveness with other people, which is very different to how we traditionally work in the NHS in more managed structures. We don't talk enough about how we feel and how we relate to each other, and developing shared decision making, and this is what this is all about.
I think lots of us came expecting an agenda and the standard sort of meeting type thing, and it's not met any of those expectations, which are doing fantastic. So it's allowed us to use both sides of our brain, think outside the box, and connect with people that we probably wouldn't otherwise have connected with in ways we wouldn't have connected.
The PechaKucha presenters that we've had tonight have just been incredible. They've been funny, they've been incredibly brave and honest. We wanted to do something different, we wanted to do something that people would remember, and we wanted to do something that reflected the work that we've been doing. So the theme that's coming through is people connecting with the values, their passions, their emotions, connecting with the reasons why they started to work in healthcare in the first place. And we didn't want a waffly 20-minute death by PowerPoint type of launch. We wanted to get straight to the point, and I think this methodology gets straight to the heart of it. I think what we set out to achieve was moving the communities on another step. It was a bit of a test, really. It felt like this was the make or break, and we took a build it and they will come kind of approach. I think George talked in the beginning, or Angela, when we opened the day, about building a container and people putting things into that container, and that container is full up and overflowing. We need to definitely build a bigger container. It's more than I could ever have hoped for this piece of work, and I think it really proves what an incredible bunch of people we're working with. It was great in the room when we asked, has anybody got any ideas for new communities, and there were 5 hands straight up there. That was brilliant, really, really inspiring. And some of the speakers have just been incredible. They just make you so proud to be part of that.
It's really important that we find new ways of working within the NHS as we move to integration, where we're working more with other colleagues. We need to build much better ways of creating that understanding, a joint understanding between how different people work, the different environments they work in, the fact that they all care about the same thing, we've got the same values. So we need to build that trust across these boundaries in order that we can really improve how the system works and how in the end it is for our clients and patients.
Co-production is important because it gives us the benefit of synergy, different ideas from different professionals, which leads to 1 + 1 = 3, and getting the benefit of that multiplying of ideas and investment in ideas and the passion to take that forward.
Today's event has been an absolute eye-opener to incredible, passionate people in each of their professions when it comes to care for individuals and for community health care. It's the first time I've ever been a part of anything like this. I have learned so much and soaking it all in. Got so much to think about. I think it's extremely beneficial that these people have gathered together today to share what they know, and I feel excited to know how it's going to move forward and help benefit those people that really need it.
The co-creation network is all about delivering the best for service users and the best for patients. It's about developing practice. So that ultimately is what it delivers. But in the journey to do that, it connects people, it builds relationships. So you end up with happier, healthier staff and providing a lot better service for your patients, for your service users. I think we've made a great start. I think we've got more work to do. I'd like to see more diverse organisations represented. But if every time we get together we can create another half a dozen communities, hopefully that's not going to take us too long. It's looking really good.